Now we're going to look into low back problem. Low back pain, myalgia, detoning muscles, pre-treatment for mobilization. Low back pain could come from several things. It could be discopathy, it could be prolapse, it could be degenerative situations for the joints. Several problems in this area. Skanlab is very beneficial, very often for pre-treatment here, to reduce the pain, reduce the tension in the muscles, and maybe like a pre-treatment for traction, mobilization, for example. How to use it on his back is very important to think about a couple of things. First, I like to put a pillow underneath his belly, so I ask him to come up a little bit. Normally I put this pillow underneath before they lay down. Straighten out the lordosis a little bit, and very often it's kind of uncomfortable for the patients to lay really flat. This gives the patients much more comfort laying there, and maybe it will reduce the pain situation as well, especially if they are in a painful situation and might even have an antalgic position of the body. By putting this pillow underneath the lower part of the back, I don't prefer using this return electrode. Then I use this rubber flat electrode instead, because that lays more stable. So I switch this one on the cable and put on this one instead. And then we have to put cream on this one as well to get as good connection as possible. Just some small, slightly with cream on it, spread it out over the electrode, and ask the patient to come up a little bit to put it underneath his belly. I had some extra cream on my finger, put it on his back. Preparing the patient with that, putting cream on, I have localized the area I'm going to treat. It's kind of, for example, from S1, sacrum 1 to L3, L4. So we were treating this area, and it's a very tense muscle in the area, and this tension probably comes out of something, from the spine, from the vertebrae, from the joints, from the discs or whatever. But if you can decrease the tension in the muscle, it's much easier for us to work the back with other things afterwards. Like I said, traction, mobilization, for example. Then after preparing the patient for treatment, appears okay on low back pain. And I get the pre-settings, 7 minutes and maximum intensity. If this has been a large area, I probably have to split it in 2 treatments or increase the treatment time a little bit extra manually. I could do that on the display. I can put plus and add some extra minutes if I needed to, if the area is very wide. And then I pinch the on button on the treatment head, and then we go. And then I ask the patient regularly if it's getting too warm, too hot, or if it's just okay. You feel okay, sir?
Yeah.
Not too warm.
No.
Mostly it takes a half minute up to a minute before they start feeling that the warming sensation is coming up, and then it's getting warmer and warmer, so we have to decrease the energy level during the treatment time. I have firm contact with my other hand. Don't try to have touch contact, have firm contact. Or I choose not to hold my hand on the patient's. Either way is okay. Like I see, I don't move too fast, because that can feel a little bit stressful for the patient. I prefer you work smooth and in a good rhythm with your treatment head. After a while, during the treatment, especially if it comes to the end of the treatment, you will see a slightly hyperemia on the skin. It starts to get a little bit reddish, nice reddish, but not really red, but telling us that the vascularization is coming up really good. And ask the patient again, it's not feeling too warm.
Oh, it's good.
This will also help people who has problem with extremely high tonus in the muscles. You can get a detonization, which gives you the possibility to stretch the muscle more, mobilize better afterwards, or work the patients better afterwards, like a pre-treatment. After finish the treatment, we have to clean the area again. First I clean the treatment head, get rid of that. and also disinfect it with some disinfection. Put it back, and then I take the rubber electrode, clean that as well. Get rid of the cream first, and then some disinfection on this one as well. Here. You can of course use the solid return electrode instead of this one, but I prefer using this one back because it lays more comfortable, especially if you have to build up the patient with a pillow, so it's much more comfortable for the patient. After doing that, we start getting rid of the cream on his back. I need some more paper for that. And then I take some wet paper, wetten it with water or disinfection. It's okay just using water actually, but I have some disinfection here. And get rid of the rest of the cream, so if you're gonna work this back afterwards, it's nice that it's not too creamy, because it gives you you slip with your fingers, you don't get a good grip on whatever you're supposed to do. Maybe you're gonna work a little bit on mobilization on different kind of joints, and then you have to have a good grip. So it's nice to get rid of that. The last thing we have to do is clean his front side when he sits up. So you have to believe me, we take away that cream as well.